Hello, everyone. Dr. Van Merkel here with another little video for you. This is an actual patient I'm doing a final thought on today. This is a patient I've had for a while. They come and go, and sometimes they get more interested, other times not. But we're going to go right into show you his test results. And now I'm going to slide this over so you can't see the patient's name and get it in position here. This patient is a 64-year-old gentleman. He's had a history of blood pressure problems. He's about 6 foot, about 210, 220. But his blood test from February of last year showed a high cholesterol 217. And his medical doctor always told him it was a problem and he needs to take statin drugs. And that's something over the years that I've been trying to get him not to take statin drugs. At 217 is not a big deal. His triglycerides are good. HDL is good at 35. We can take a peek here at the LDL, a 157, and it was 6.2. And we're going to look at why that may be. But in this last year, we haven't seen him, and I know he is very concerned about things, about the cholesterol, because his medical doctor made a big deal. But what we see here today, now, is we see from 215 to 131 that the creatinine has come up from 1.13 to 1.3. We see the protein is lower. We see the creatine kinase jump from 114 to 149. And we see going on down further that his BNP is a little bit high. We like it to be less than 40. And his SED rate went from 4 up to 15. Okay, doctors, if you haven't talked to this patient like I have it, okay, I have. But when I see the results and you look at the labs and its history, what could have caused the kidneys to be kidney and the creatinine to go up, GFR to go down, it's early kidney disease, the protein to go down, the CK to go up, SED rate go up, and the BNP go up. What could cause that? He's on statins. Yeah, when I did the reported findings, he is on statins. And for the last year, and that's why his cholesterol's come down. That's why his cholesterol's come down at the risk of developing kidney disease and heart problems. The total cholesterol did go down, but now it is too low. So that's a problem. So let's look what we did on our final thoughts. My first question my first thing on the final thoughts is, are you on any meds? Over-the-counter meds even. Creatinine is high, GFR is low, indicating early kidney problems. Not critical, but needs to improve. There are significant findings of low protein, high SED rate. The BNP is also a little high. Then I usually like to give some normal things, that's going on. Thyroid function pill is normal. Diabetic factor is a little worse, but not much. Just tighten up your diet a little bit more. And then right here, the cholesterol dropped a lot in the past year from 217 down to 130, which is now too low. Especially if drugs are used to lower it. If statins are being used, it's likely the cause of the elevated creatinine and bun and low protein. Statins also cause glucose dysregulation. It makes it harder to regulate your glucose. And his hormones testosterone looks pretty good. The hair and urine tests are recent. And we're going to take a look at those here and just look at the hair test on this. So let me zip down to the hair test, and here we are at the hair test. This is very common. Not much shows up on the hair back in 2015, or in late 2019. Now, if you go back and look at my recommendations on my current final thoughts, I recommend that they retest the hair now in the DMSA. Now I'm going to zip down to the DMSA, to the urine test. And what do you think we'll find on the urine test? Getting to it here. Okay. Here we go. All right. Here's the test from 9/21/2014, and then there's the one. It's really annoying when that little thing comes up on your screen. 9/30/2018, and we see extreme high levels of lead. Extreme high levels of lead. And I do believe that he's had lead for years. This is the highest lead he's had in several years. And I do believe that the lead is why he's got problems with cholesterol and LDL. If you remember in the notes, cholesterol and LDL help. It's thought that that's the way the body protects the nerves, brain, and hormones, other structures from bacterial toxins, heavy metal toxins, chemical toxins. So the LDL, cholesterol are high because of other things going on. And one of them is very high lead. So hope that helps. And if you go back and we can pull up, pull up that final thoughts. And here we have, what's the most important thing on the final thoughts, doctor? Right here, retested creatinine, SED rate BNP again in 3 months, and a complete blood test with hormones in BNP, and also recommended advanced coronary panel again in 1 year. Now the BNP is in the advanced coronary panel. I just wanted to make sure that the patient understands how important that BNP is. So I say take the vitamins and tighten up the diet a little bit. Sincerely, Dr. Merkel. And this is a final thought on this patient. Hope this is beneficial to you. I'm Dr. Merkel.